and any one of us can get it. As we endeavor to facilitate safe travels, we encourage all stakeholders to play their part diligently for success of the whole exercise. We also request the airlines and travelers to cooperate in the use of the online traveler surveillance forms, as this will hasten the airport health clearance, as well as eradicate the risk that comes with paper transactions. Fellow Kenyans, we have installed technology to assist our port health officials with surveillance. These include state-of-the-art thermal scanners at our ports, and more are being set up to ensure that we are all well prepared. We have established sanitization points all across the airport for staff and travelers alike, including installation of protective screens on service counters, as you can witness from where we are standing. And the screens protect our people from exposure as they serve the clients so as to ensure everyone has a low chance or zero chance of getting the infections. We have made progress of filling in forms as paperless as possible. We have also ensured that there will be regular disinfection of common use areas in the airport to ensure that the virus doesn't linger. In that regard, we will be disinfecting and sanitizing services at the airports on a regular basis to ensure the safest and conducive environment for work and travel. We have also trained all airport staff on COVID-19 safety protocols, emergency procedures, and quarantine procedures. This is to ensure that they can keep themselves and the public safe. As much as we have put all these measures in place, and as much as we would wish to make sure passengers have the most stress-free travel, there might be instances when, due to prevailing circumstances, things might change, leading to inconveniences. Let's be honest about this, and let's be clear and upfront about it too. Yet again, I wish to urge the indulgence of passengers and Kenyans as we try our best to facilitate international travel in and out of the country, while at the same time keeping the pandemic under check. I also wish to appeal to our port health officials to undertake their duties with respect, care, and concern, aware that these are not normal times. We should work hard to ensure minimal inconveniences to the extent possible. And may I also say this, please follow the protocols issued by the ministry to avoid unnecessary travel and gatherings. When you are considering your travel plans, ask yourself whether you really need to travel or whether you can achieve what you need to achieve without having to do so. I think that's very important because we are not opening the airspace because the cases have gone down. No, sir, no, madam. We are doing so because we are confident that the necessary measures to resume normal economic activity have been taken. It is ironic that we are actually opening up at a time when you would have been expecting that this is a time to close under normal circumstances. But this is not the case. And the reason is that we have to adopt to this new normal. Nobody has any idea when this virus is going to be killed or just go away. Nobody knows. And there's a limit to how much you can contain and close yourselves, even as you protect yourselves. For the last over 5 months, we have taught Kenyans, people all over the world have experienced this disease, and we believe that passengers and workers alike are so aware of what is happening around them that it is possible to proceed without necessarily closing everything at the same time. We can also see, even where you stand on the floor, that the airport is ready for this. And I want to congratulate CS Macharia, the Airports Authority, Kenya Airways. I want to congratulate you for the very, very hard work you have done over the last couple of months to ensure that what we are doing today is possible. So before I take any questions regarding the situation with COVID-19 or any other health concerns, I want to ask my brother Macharia to come and also say a few things.
Thank you very much, my brother, C.S. Kagwe. And once again, I would like also to commend the health team, because on a 24/7 basis, C.S. Kagwe and the entire team have been working tirelessly to make sure that this COVID-19 is managed and contained. We know you not had a lot of rest since this COVID came to us in March, but I would like really to appreciate the sacrifice which has been made by you, CS, and your team, DG, Amoth, the PS, and everybody else in the ministry. The last time we stood here, where we are right now, it was on the 8th of July. We had come here to inspect these facilities, Jomo Kenyatta International Airport, to determine whether it would be ready for the reopening of our airspace. We'd like to commend the Kenya Airports Authority, Kenya Civil Aviation, and the key stakeholder, Kenya Airways, for having facilitated this work to be done to the standard we can see for ourselves. After we came on the 8th of July, we confirmed that indeed Jomo Kenyatta Airport was ready. And then we inspected Moi International in Mombasa, we inspected Kisumu, we inspected Eldoret Airport. And that allowed us to then reopen the airspace, local airspace, on the 15th of July. We came here at Jomo Kenyatta Airport to launch the local flights on the 15th. And we said when we came here on the 15th of July that we came to make sure that the local flights will provide us with a benchmark for the international flights. And we told the staff here, we told KQ, we told the other airlines that they were on test period between 15th of July and today. And I'm delighted to say they did pass the test. That's why today we have launched the international flights. And we started with a busy day because being the first day, we thought things would be very quiet. But I'd like to confirm to Kenyans that already this international airport has seen departure of a 787 aircraft to London Heathrow this morning. We've seen a flight to Dubai. We've seen a flight to Addis Ababa, Kigali, and Dakar, Senegal. And we expect arrivals, Kenya Airways flight. We expect British Airways this evening. We expect KLM from Amsterdam and Lufthansa from Frankfurt, Germany. So you can see we started on the right footing, and we are delighted with the development so far. I know you may ask, but let me clarify one thing which is important, Waziri, even before the questions are asked. This morning, I had an extensive discussion with my counterpart in Tanzania, because you recall, and some of you are aware, there was an issue with regard to flights from Tanzania into Kenya. And we wanted to clarify, me and my brother, the Minister for Transport, Engineer Kamwere of Tanzania, that indeed there is no misunderstanding. Kenya has never banned flights from Tanzania. Kenya has never banned travelers from Tanzania. What we have done is to indicate certain health-related protocols of people arriving from various countries. And this is a protocol which is contained in a communique which we gave you on Thursday, and for which we are reviewing in terms of countries which will be coming here with passengers exempt from quarantine. And so I'd like to confirm we did agree with the Minister for Transport to Tanzania. We shall be making this announcement that indeed we've met by virtual meeting this morning, and we have agreed on all issues, and that advisory which was given by Tanzania Civil Aviation Authority yesterday, we believe by the end of the day it will be reversed with regard to the Kenya Airways flights from here to Tanzania. Thank you very much.
Asante sana. Thank you very much, CS Macharia, for that info. I now want to turn to what some people have called that boring report. I want to assure whoever suggests that it is boring, that it is nowhere near boring. This is extremely important information for Kenyans, and you are supposed to be listening very keenly so that you can take action depending on where you are. Today, 727 people have been confirmed positive out of a sample of some 6,371. 696 of those are Kenyans, while 31 are foreigners. 465 are male, while 262 are female. We have got an infant who is only 1 year old who is positive, and a 92-year-old man as well. 310,330 people in Kenya cumulatively have tested positive so far. We are also pleased that 254 patients have recovered from the disease, out of which 88 people are from home-based care programs, while 166 have been released from various hospitals. Therefore, even though we have the cumulative numbers that we now have of COVID-19, we also are happy because some 8,419 have recovered. But just to establish that the fact that we are opening up does not mean that we are safe now, is that today we also report the highest number of fatalities. 23 patients have died from the disease in the last 24 hours, bringing our fatality to 364. These are 364 families that have been affected, 364 Kenyans who have succumbed to this disease. And our sincere condolences go to the bereaved families and friends of those departed. Nairobi continues to be a hotspot with 470 people in Kiambu, in Nairobi, having the virus. Kiambu follows closely at 64. Kajiado has 25 cases. Kirinyaga now is a growing area as well with 20. Mombasa declining at 16. Migori, 15. Busia, 13. Machakos, 12. Laikipia, 11. And so on and so forth. The list is with you. But the important thing to note here is that there is, except for the coast area, most of the other places are areas where the disease is actually growing. The virus is growing. So even as we go out on our normal business, it is good that we are doing so, having appreciated that there is a new normal. And that is the only reason why today we are where we are. It is not that the virus has evened out or that there is no concern. We have more concern now than ever before. But we also know that life must continue, and we are also now a lot more prepared than we ever were at the time that we started closure of everything. Of importance also is that when we look at the list of those who have died today, one of them is a 16-year-old, a young person who is 16 years old. And it's sad when that happens, and we know that there has been this myth, and I repeated that yesterday, that we are increasingly seeing younger and younger people passing away, and therefore we want to urge the young people to desist from as much socializing as they are. They have continued to do so, even in homes and so on. We want to ask to desist. We want to urge that people stop socializing and stop going to gatherings, because this is where this disease is spreading. Tafadhalini tujikinge kwa sababu hakuna ubaguzi. Hii virusi haina ubaguzi wa miaka. I want to stop there and take questions. When you ask a question, please also say who the question is aimed at so that they can explain. Yes, Shemtai.
My name is Chemutai Goin from Citizen TV. Just speaking about the number of deaths. Today, 23 deaths. Yesterday, 16. The day before, 14. And the rising number of deaths are also being seen in, like Kiambu County, for instance. Yesterday, 10 were from Kiambu Level 5 Hospital. Could you kindly just tell us, is it about the facility? Is it about the condition of those who passed away? And possibly, are you considering putting in place more stringent measures or special measures for particular counties that are increasingly reporting increased number of positive cases? And a quick second one, from the number of samples that are tested per day, possibly this is to Dr. Amoth, could you kindly tell us whether part of those include the repeat test? For instance, if somebody has tested positive and then needs to do a repeat test after 14 days to confirm whether they're negative, is this also cumulatively included in that total samples tested in a day? Thank you.
I'm Brian Otieno from KTN News. There's a person who collapsed and died in Kawangware 3 days ago. And their body has been lying at the Chiromo mortuary since.
Speaker Brian.
Yeah, there's a person who collapsed and died in Kawangware, and their body has been lying at the Chiromo mortuary for the past 3 days. Now, to date, no samples have been taken from their body, as the family claims, and they have tried to seek help at the KNH and another facility. Now, the mortuary's administration is telling them, according to them, that they should just accept that the person died of COVID and accept that their body be wrapped in body bags so that they can be given the body to go and bury it. So can the ministry comment on this?
Yes, the lady.
Helen Aura from NTV. My questions are to the CS of Transport. What were your concerns regarding Tanzania as to why it did not make it to the list earlier? And my second question also is, you've said you're going to review the issues that were there earlier on. So after the review, will you be confident in telling Kenyans that you'll be allowing Tanzanians to come within the country. Then my third question is regarding you said for internationals to come into the country, they need a PCR, a COVID negative certificate, within 96 hours. My question is, why are we allowing only one certificate yet? Can we be able to allow the internationals who are coming in to present 2 negative certificates? Because we understand also that an error could occur in the first test.
Hi, my name is Graham Kajila from The Standard. My question is in regards to the deaths. How do you categorize deaths? If, for example, someone dies from an accident, and when dies from an accident and tests COVID positive, because I've seen the list, the breakdown on the underlying condition, I'm seeing things like head injury. So I'd like to understand, how does head injury end up becoming an underlying condition for someone dying from COVID-19? So is it a death from that? Is it a COVID-19 death, or a COVID-19 death and a COVID-19 case, or just a COVID-19 case? And also on the issue of recoveries, do you have older patients, someone who is 80 or 90 who has recovered from the disease, or what is the range of recovery in terms of old age for patients who test positive for COVID?
Take the last question.
Hello, my name is David Muthoka from TV47. I have 2 questions for Waziri Transport. With negotiations underway, how soon now can we see flights come from Tanzania into the country and vice versa? Then the second question, are the disparities now in how both countries are handling COVID-19 a hindrance now to the smooth air travel between the 2 neighboring countries?
Santeni, thank you very much indeed. On the issue, I think I'll respond to one question. Most of them were questions to my colleagues here. So I'll respond to only one question, which is Shemtai's issue of the increasing the deaths in the counties and what is expected. I think the one special thing about 2 counties, particularly 3 counties, we have got Kiambu, we have got Machakos and Kajiado. And if you look at the environs of Nairobi, it is actually the Nairobi metropolitan, because Kiambu, and it's very difficult to tell the boundary between Kiambu, Machakos, and Nairobi, including Kajiado, because of Athi River. So we will be treating, going forward, we will be treating those 3 counties, particularly the nearer areas, as part of the strategic support we will give to those counties. So we can obviously see that they are getting overloaded. For example, yesterday we took PPEs and other commodities to the Kiambu County, and as a national government, we will continue to give extra support, just like we did to Mombasa. When Mombasa was having serious issues, we also give them extra support. So Kiambu is in that state now and needs national government support, and not just to rely on itself because of the number of cases and particularly the number of deaths. Brian, I wasn't actually aware of the mortuary situation. You said there was somebody from Kawangware. I'm not aware of it. I'm going to ask Dr. Amoth, maybe he's aware. He can respond to that. But I want to invite, I think first, CS Macharia, and then Dr. Amoth to answer the questions, and thereafter we'll call it a day. Before I do so, I just want to wish each and everyone here, all the counter, all of you serving our counters, I just want to once again thank you. Thank you sincerely. You are the ones who make travel a good experience, and as Kenyans, we owe you. Thank you so much. You are part of the frontline support. As we thank our health workers, we also want to thank you and ask you to be careful and to protect yourselves. Asanteni. CS Macharia, please.
Once again, thank you very much, CS Kagwe. And now, the questions, one of them was from, I think, NTV, young lady from NTV, with regard to the concerns we have, or we had, for Tanzania. I think it may be inappropriate to start discussing individual countries because, as you're aware, we have in total about 180 countries, but so far, only 19 have been listed as having been exempt, or their travelers being exempt from quarantine. So if you want to discuss, I think let's not discuss individual countries. This is a matter which we, of course, have bilateral discussions, like we had this morning with my colleague, but we shall not actually get into that area of discussing specific concerns, because there are a lot of other countries, like I said, 160 countries, for which, they're not on the list, but we are not discussing them individually. I think you also raised the issue about, if I got you right, about how confident we are about now allowing Kenyans to come and other travelers to come. I think you can see for yourself that in terms of these facilities, there have been a lot of changes. It's not just Jomo Kenyatta Airport, but all points of entry. We have made major investments to make sure that we can ensure that passengers, travelers, when they come in, they are safe, and we are safe, us who are living here. I just hope that's the question you wanted to ask. You see, if you look at some of the East African protocols we've been having, even without having to narrow down on Tanzania, we've had interactions across the border. So this is something which, of course, will be improved, having set this date of the 1st of August. But if you look what has happened the last 3 months, we've had border crossings at Namanga. We've had border crossings across Malaba. So within East Africa, there's been a lot of actually movement of people. And so all we are saying now is from today, the airspace has been open. And so in addition to large transport, now we shall be having travelers from within the region coming by air. That's what we are saying. We are more confident in terms of the protocols which have been put in place. I think the gentleman asked about how soon shall we have travelers from Tanzania coming in. We are hoping as early as today, because like I said, we managed to clear the issues we had with my colleague, my counterpart in Tanzania. We never stopped those flights. They never stopped our flights. And this very minor issue has been sorted out. And we believe that if not today, by tomorrow, we shall find Kenya Airways, flying again. And of course, in terms of gaps which we have between Kenya and various countries in terms of management of COVID, these are being addressed through the protocols which have been developed through a multi-agency effort between Ministry of Health, Ministry of Transport, Ministry of Foreign Affairs, Ministry of Interior. So if there are gaps between ourselves and any other country with regard to the management of COVID, they are addressed through those detailed protocols to make sure that the risk is mitigated. Thank you.
Thank you, CS Kagwe, CS Macharia. I think my question was regarding the deaths from Chemutai, from Kiambu County. Of course, as we get more cases, the deaths, of course, will also increase significantly. However, of importance is that our case fatality ratio or rate has remained at about 1.6, 1.7% against a global average of 4 to 4.5%. One of the contributing factors to the increasing number of deaths, of course, could be patients presenting late to the facilities. For example, the deaths that we have reported today, I know for sure 2 of those deaths were community deaths. These are deaths that happened at household level. And it's important, and listen very carefully, Kenyans, to this information, that you can have a very serious COVID disease condition but you may not be aware. You would behave normally, but when you reach the hospital, the doctors will quickly usher you into the critical care when they look at your oxygen saturation. So there's something in COVID called happy hypoxia. It means your lungs are not working optimally, but you feel otherwise well. So the message to Kenyans is that if you feel unwell, please seek for healthcare services support. In terms of the tests that we report on a daily basis are individual tests. We don't count the repeat tests. And that is one of the reasons that delays, we usually have a delay sometimes, so that we can go through the entire line list and remove the repeat tests so that we don't count them as a separate test. So these are individual single tests for a person. Even if you are tested 3 times, we'll only count you once for the report we generate here. The person, the deceased from Kawangware, I was also not aware, and I think the information from the mortuary is not correct. Sudden death, of course, requires investigation, including for COVID-19, and I'll be able to pick this one with my team, surveillance team, so that they can quickly go to Chiromo to be able to pick a posthumous sample before the burial is conducted. That is important because then if you just bury without doing the test, then the family members who could have been exposed will not be able to do contact tracing because we shall have not known the cause of the death. Graham, in terms of how we categorize COVID deaths, countries differ. This categorization differs from county to county. For us in Kenya, what we do is that if you have any condition notwithstanding and we test you for COVID-19 and you test positive, we consider that a COVID-19 positive case or a COVID-19 positive death. And the clinicians have their judicious ways of being able to tell even a patient who has head injury, who is not improving, then because of the index of suspicion, they could be able to order for a COVID-19 test, in which case if it turns positive, the primary problem was head injury, but of course now the head injury which affects your ability to breathe is exacerbated by the COVID-19, and we characterize that as a COVID-19 death. I thank you.
Let me just re-emphasize one point, because it's very important to make sure you get it right. This is the issue about have we banned any country or any traveler from any country coming to our country. We have not. What you've done is to assess the risk with regard to COVID transmission and management, and allowed certain countries or travelers from certain countries to come here, of course with the PCR-based COVID certificate, and then with that, as long as it is done within 96 hours, to allow them to go about their business without having to be quarantined. That needs to be emphasized. We have not closed the airspace for any country, for any traveler. Of course, they must be authorized in terms of documentation, but we have not. What we have done is to say from certain countries, we shall be reviewing to indicate that if you come here, you can actually go about your business without having to be quarantined for 14 days. And the list we have given you so far of 19 countries, we continue to review that list. Even tomorrow, Sunday, we shall be adding more countries to that list to make sure that we go back to where we started before COVID. But of course, this will depend on how countries are managing the transmission and the containment of COVID in their own countries.
Maybe you can explain the scientific reasoning behind the country.
What would the second negative test, what value would it add? It would not add any value. But the science behind this is basically that countries are categorized into 3: high-risk countries, medium-risk countries, and low-risk countries. And this is based on the characteristic of transmission of the disease. For example, in countries which have not recorded any cases of COVID-19, and these are very few countries, probably in the Pacific Islands, that is category 1. Category 2 are countries which have sporadic imported cases. Then category 3 are countries which are reporting clusters based on geographical space or time-based clusters, and the fourth is community transmission, like what we are dealing with in Kenya. So based on that, we have a scenario that we develop. So if your point of departure is like, say, America, which is reporting community transmission, and you are coming to a point of arrival in Kenya, which is also experiencing community transmission, in terms of risk, epidemiological risk of transmission, there is no significant change. So what you need to do is to enhance your capacity to be able to screen those people when they come at your point of entry, put into place proper risk communication, and of course ensure that your healthcare system has the capability to be able to absorb any new cases. Scenario 2 is where somebody is departing from a country where there's intense transmission, community transmission, to a point of arrival where there's less transmission. Of course, that poses a significant risk in terms of epidemiological transmission. So then you need to take extra measures to ensure that you avoid importation through the public health social measures, including hand washing, wearing of masks, the sanitizers, blah, blah. Then scenario 3 is where the two countries are at par, your point of departure and your point of arrival. Sorry, scenario 3 is where the risk from where you are coming from is lower than where you are going to. Like somebody who is coming from a low risk where there's no transmission, coming into Kenya where there's no, there's community transmission. So that also does not pose a risk to the country of arrival. So based on that, then we categorize the countries into high risk, medium risk, and low risk. And because this is an evolving situation, this is reviewed on a daily basis through the WHO situation reports, and also what happens in country, to be able to enable us make appropriate judgment into which people will allow without quarantine and which people will allow but have to undergo quarantine. Thank you.